Welcome to North of 60. I'm Heidi Schweighoefer. Today my guest is Dr. Tricia Bedrick, the owner of the NeoSkin Medical Spa and Acne Clinic right in downtown Hudson. And I also have another guest here, my daughter Morgan. I've asked her to be here specifically to play patient today. When I visited Dr. Bedrick at her office, I was able to use a facial analyzer machine, and the results were very startling, and I thought maybe it would be of interest for you to see how this works. So, Dr. Bedrick, I'm going to have you demonstrate.
Okay, well, thank you, Morgan, for agreeing to do this. Today we have the Visia facial analyzer, and what we're going to do is we are going to demonstrate how it works and then how it analyzes the skin, so it helps us recommend various treatments that we offer at our clinic. So Morgan, if you could go ahead and put your chin there and lean forward. Okay, I'm going to have you close your eyes. There's going to be 3 flashes of light. Oh. Okay, so now we're going to slide the camera over. I'm going to ask you to keep your eyes closed again. Another 3 flashes. And the final 3. Okay, so all the pictures are complete. You can relax back. Now what we're going to do is I'm going to make sure that we are in the right skin tone. So how this Visia works is it's going to compare women of your age with your skin type, okay? And there's going to be various measures that you'll see that it's going to do. And then I'll explain everything to you once we get the results. Okay, so here it's running through the different measures right now. Okay. So what this is this is your beautiful face right here, right? And this is your scoring system. This is much like I always say, like a grade on a test. You want to get 100%. Anything over 50 is going to be in the green, which is good, and anything below is going to be in red. So on the frontal view, this is saying how many spots does it see that are visible, okay? So, and remember, we're comparing this to women your own age with your own skin color. Okay, so now wrinkles, this is just showing you on the forehead, but if we go ahead and we turn this to the side view, you can see this is the area that we tend to Botox. So these are fine lines are light green, and dark lines are deeper lines. So we can do this with various treatments. We can do medical grade skincare, Botox, just different types of things. So let's look at some texture. So texture is kind of the ups and downs of your skin. So I always say that the yellow is like the sunlight, it's the high areas, and the blue is like a water, like deeper. So we have some texture there, and let's see. Let's put you on the front the front view. So you can see various areas of the skin when we will kind of rate a different number. So you're in the green there, right? Okay. So what we do, and this is pore size. So pores tend to get clogged, and they tend to stretch as we get older. So we're looking at pore size there. On this view, this will show you UV spots. This is sun damage that's in the upper layer, outer layers of skin, okay? So what happens next is the brown spots. So these spots are the deeper that is gonna come out as you age, okay? So all those times that when we go outside and we don't put sunscreen on or wear a hat, this will catch up to us later. So red areas, really not a big concern. It is only a concern usually when I have a lot of rosacea, when I'm treating rosacea. Porphyrins are just bacteria on the skin. Everybody has them. It just is what it is. So the overview, this shows you all the different measures that we did, and you can kind of even change them to, different profiles. So that was the forward view. And then I usually like this view because we tend to sleep on one side or the other. So this, if we were at the office right now, I would print this out for you, and there you'd have it. So this is the next thing that the Vizia can do is do a true skin age. So true skin age, I always ask somebody if they would like me to press this button because sometimes people have had reactions, and I don't really, but I always say, no matter what it is, so you're actually doing fantastic. So on this, so Morgan is 29 and her skin age is showing 29. So wonderful. Then am I not going to recommend anything? No, I'm going to recommend different things. First, I'd recommend skincare, and then see how it helps with some of the wrinkles and texture there, and then we can kind of go from there. Eyelashes, it will even measure your eyelash length. She has a little bit of, looks like liner on. You know what, I'm not gonna do this eyelash length because you do have, we'll just put it in. You do have mascara on, so it's going to alter the results. So out of all the links that you could be, 5 being like very sparse, very not very long, you're at a 3. So this would differ if we had the mascara off. And there are products that we can prescribe to help with eyelash length. Let's see. Oh, this one's my new favorite one, actually. So let's put it on the front view. So this is an age simulator, all right? And so what it's going to do, it can take us down, I think it takes us down 10 years and down 15 years and up 15 years. So you can kind of see. So
you look like grandma.
So that's commonly what I will hear, like, oh, that looks a little bit like my mom, my sister, my grandmother. So let me stop it up here. Let me move it myself. Okay. So when I tell people that, hey, we can start doing things now at age 29, so this doesn't progress to this level. When I look at this, I see some wrinkling in the skin, some forehead lines, some loss of volume around the face, and all. So there is a degree of even at 29 where I look at these procedures as preventative. Okay, and then we can go in here and we can actually write down. We could tap in what procedures I would recommend for various different measures that we had there. But yeah, so that is
so interesting.
Yeah, that is the Vizia, and I'm going to put it back on the view the pictures, and let's just.
Are most people surprised when they see their skin in this? Analyzed like this?
Yeah, yes,
I bet.
Yes, they are. So I've been wanting this machine for a really long time, and I finally got it last year, and we debuted it at our customer appreciation, which is usually the first week in October, and there was a line just waiting for this, and some of the products that we have, people are saying, does it really work? Does it influence that? Well, yes, because I can show you that it does. I can do repeat exams and things like that.
Right.
And it's a little easier to say, like, when I recommend a laser treatment, I can then say, back it up saying, well, your texture is really the one thing that's pulling your skin age down. So that would really be one of the most effective treatments for you.
Okay.
So it's, you know, you're coming to me as as the professional to give you recommendations, but at the same time, this is very visual, and it can help validate what I'm my recommendations for the patient.
So your clients would then come back in, let's say 6 months after having things done, and go back on and have their skin analyzed, or a year? Or
Sometimes, yeah, probably like yearly.
Okay.
We like to take a look because some of the treatments, you know, even with like our laser, you're going to be producing collagen continuously
All right.
from
well,
that.
We'll talk about that
yeah.
when we sit down.
So so that's the Visia-Facial Analyzer. We love it.
I can see that.
Right now, we just do a complimentary consultation with this, especially the new patients, just to let you know. And we're going to be able to not only just give you a handout, we're eventually going to be able to send it to an app on your phone, so you can look at it at home,
Morgan.
or whenever you want to. Yeah.
You can look at it every day if you want.
If you want, exactly. So
Thank you
you're
so
welcome.
much for doing this. And Morgan, thank you for being the facially analyzed patient. I think that what we will do is sit down and talk a little bit. I'm back with Dr. Tricia Bedrick of the NeoSkin Spa. You saw the facial analyzer in use, and now we're going to talk a little bit about the services that are offered. And first, tell me about yourself. How did you end up in this business?
So thank you for having me. First of all, I appreciate it.
Thank you.
My name is Tricia Bedrick. By practice, I'm a family practice doctor. I started doing Botox and fillers about 10 years ago after I personally suffered from a boating accident where I had a whiplash and a herniated disc. I was in a lot of pain.
Heavens.
Yeah, so my neurologist thought, the migraines would resolve after I had the surgery on my neck. They did not. So I felt like I just had a lot of tension in the back of my neck here. And so what we did was we used Botox to relax some of that spasm.
I've heard that.
And it really helped me. So from that point, after about 3 treatments, 9 months later, I went and got certified for Botox, intending just to bring it into my family practice for the treatment of migraines. However, when you're a female family doctor, you're probably going to get about 99% women. And so one day I had the Botox, I had a migraine patient first client of the day, and then the next patient was a pap smear, so she's waiting in the room for the pap smear, and the little Botox bottle was empty, and when I walked in, she's like, I know what that bottle is. Could you just treat me here? And I said, sure. And she's like, pap and my Botox. So she's like 2 check marks off my list. So she was so happy. When she checked out, she was telling the checkout desk, and then the next patient asked for it too. So that's how it kind of got started. Yeah. Mm-hmm.
Now, why did you decide to come into Hudson?
Okay, so I was practicing at Summa Hospitals in Cuyahoga Falls, and then there was some redistribution of services. So really they wanted the dermatologists and the plastic surgeons to be offering the services. So I already had people that were established and wanting me to do their services. So I went ahead and I opened up my own business, and it wasn't that big of a business. I just had a little rolling suitcase, and I would go to a chiropractor in Brecksville, a day spa in Medina, a hair salon in Aurora.
Wow.
And so I would just take my things there, and by doing that, I still maintained my family practice, and then I just kind of did it on the side just to appease my interest in it. And then it started to grow and become a little bit more in demand for my services. So after about 2 years of doing that, I went ahead and took a step back from family practice, and then I decided, well, let's go ahead and open a storefront. And I had been renting rooms, and I found a place in Hudson, and everybody's been very welcoming of my services since I opened 3 years ago.
And the clinic is absolutely stunning. It's a single little building, is it not?
Yes, it is.
Right off the parking deck by the yoga lounge, I think.
Exactly. So we started down in a 1,275 square foot place that had 2 rooms. Then we kept dividing the rooms, and then we ended up with 4 rooms. And then, so in January of this year, of 2019, we moved over to First and Main with a larger space. And it's really, we took some of our, we just kind of stepped our decor up a little bit.
Oh,
and
it's a beautiful place.
And now we're proud to say that we are a full service medical spa. So we also do body shaping with cool sculpting.
Yeah, I want to get to that in a minute.
So that's what we were really happy about, but thank you.
How many employees do you have? It looked like there were quite a few there.
Yeah, so 3 years ago, it started out me and a front desk gal. Now we're up to 18.
18?
Yes.
Wow, congratulations.
Thank you.
That's wonderful.
So I'm the physician. We have 3 nurse practitioners. We have two nurse injectors, 2 nurses doing our body sculpting, and 1 esthetician that runs the acne clinic, and another esthetician that does general services.
Excellent.
And we have wonderful, tremendous support staff.
Yes, I would hope. Good. Now, let's talk about senior skin. Mm-hmm. This show is really for folks over the age of 60. I know that our skin concerns are a little bit different than my daughter's skin concerns. And we've had years of accumulated sun damage. So for people who want to do the no interventions, but they want to have the best face forward, what do you recommend for those kinds of folks?
Well, I always start by saying, I use an example of, I want you to think of young, healthy skin as like a grape, and I want you to think of older skin as a raisin. All right.
So I'm the raisin.
And
all right.
So what I say is the skin cell is like a factory, and the factory's job is to produce collagen, which is like the fiber in the grape, to produce elastin, which is the bounciness of that grape, and the juice, which is hyaluronic acid. That's the job of the skin cell. So when we're nice and young, our skin cell factories are working 100%. But every 10 years, the skin cell factory slows down 10%. Every 10 years. So really when our skin ages, it just means that skin cell is slowing down.
Yeah.
However, the factory has all its parts, and it just needs to be woken up. So by using medical grade skincare and some of the medical services that we provide, it's going to wake up the skin cell and say, wake up the factory, fire it up, make me some new collagen, elastin, and hyaluronic acid. So my skin that's looking like a raisin, we can force it back to look more like the grape.
Now, and you can do that with the skincare line. I know you carry one that I have really enjoyed using. And then lasers and so on and so forth.
Yes, it's really a comprehensive approach of what we try to get the best results. So when we're doing daily skincare, we use ZO. It's
Yes.
Dr. Obaji's
Yes.
new line, which we just met him a couple weeks ago, and it's truly amazing amazing story, amazing company he has. So we're really proud to represent him in this area. But what we look at the daily skincare as that homework, that kind of keeping that skin cell awake. All right. So what a lot of people don't know is that medical grade skincare is actually, it's formulated so that it gets the active ingredients go through the dead layer of outer skin and don't release the active ingredients until they're down to the live skin cell. So this varies. This is markedly different from things that you see over the counter. You might even see a doctor's name on something in Ulta or Sephora.
Yes.
But they don't.
All the time.
When you're medical grade, you have to prove that your active ingredients release lower into the skin. So it's estimated that 90% of things that we use over the counter only go on the outer layer of dead skin. So
even the ones that are physician lines that one can
they don't
buy.
have to prove it unless they're medical grade. That means that they're dispensed by a physician.
No
They're
kidding. I
approved to go
never
down.
knew that.
So that's why when people start to use the line that we carry, they're like, I've never had results like this. Well, that's because these active ingredients are getting to where they're supposed to that live skin cell to wake it up, and tell it to fire up the engine, make some collagen, elastin, and hyaluronic acid.
Talk a little bit about lasers, then tell me a little bit about fillers, because I know in talking to you, I learned about the 2 lasers that you have. Am I calling them?
Yeah.
They're both,
Yeah.
and I'm gotta admit I'm scared of injectables right now. So talk about that a little bit.
Okay.
The lasers first.
Great. So the lasers, what we do with the lasers, we have the Cyton Jewel, which is the whole platform of our laser, and it has different things that it can do. So I invested in the Halo resurfacing laser, and this is one of the newer lasers on the market. It's out for about 3.5, 4 years now, and I love it because compared to the old lasers, the downtime is dramatically different.
I used to hear that you'd be a week out
Yes.
of work.
A week or 2, and you'll be in your house putting
Yes.
on Aquaphor.
Yes.
I had a laser at my Halo last year, and I had it on a Thursday afternoon. I kind of relaxed that day. It was a little hot for 2 hours, but then it just felt like a sunburn. Friday, I went to work. I put eye makeup on, a little bit of lipstick. I had a little swelling right here, a little redness, but that was starting to dissipate by Friday evening. Went out to dinner with my husband that night. Nobody said anything. Next day, I worked out.
Oh, that's amazing.
I had a little, like a coffee ground look to my skin, but it just looked like dark freckles. And that started to come off Saturday night. We went out to dinner. Sunday morning, went to church. People were saying, your skin's starting to look good. What did you do? And
you knew it worked.
Yeah, and by going back to work on Monday, I was totally recovered. So when I say downtime, I mean, your skin might not look the best, but I wasn't down and out where I had to stay home. So what the Halo laser, the science behind this laser is very phenomenal. It's a hybrid laser. It's 2 lasers in one. And I always say, before I explain it, I always say, people understand aerating their lawn, especially people over the age of 60, because
Every year, every spring.
right, because 20-year-olds don't always know what aerating the lawn is.
I'm sure.
So anyway, we aerate the lawn, we poke holes in the lawn, right, and then we put some fertilizer down into those holes. So that's going to stimulate the roots, and your grass is going to come up thicker and greener. Okay, so the laser is the same concept. And what it is, it's 2 lasers in one. The first laser pokes a hole in the dead outer layer of skin. The second laser goes ahead and heats up the deep tissue almost down to where the skin cell is. Okay, that deep tissue is going to come up to the surface, and it's going to look like a coffee ground or a little flake, and it will come off. But why did I poke a hole in the skin? Because it's going to send a big signal to that skin cell that says, hey, wake up. We have a little injury here. It's a controlled injury, but we need new skin formed. So we force him, we stimulate that skin cell to make new skin. And that's how we take from the raisin back to the grape. And that collagen and that skin is going to be there for 2 years.
I was going to ask about permanence for things, how often one has to do things. So the time is whipping by here. For injectables, let's say Botox, are these permanent solutions, or does one come in on a monthly basis, or how do these work?
Okay, so the laser, just to finish off on that, the laser is usually once a year, unless there's some skin textures that we really have to treat multiple times.
Okay.
Then we kind of give you an individualized treatment plan there. With Botox is a muscle relaxer that we inject through the skin into the muscle, and that's just going to relax the muscle. Why would we want that? Because that muscle is attached to the skin, and when the muscle contracts, it forms a line.
Right.
Okay, and we don't really like that, because we really what we're trying to do here is just look at your dark pupil. When my eye lands on your pupil, that sends a signal to my brain that says this is beauty. okay? So anything that distracts or slows down, anything that's dark, so a little shadow from a wrinkle, a pigment, that is, my eye will notice that first, and then I'll go back to your pupil. So a lot of times when I say that I specialize in natural peeling enhancements, it's because you're not looking at what I'm doing, you're looking at the patient's eyes. And so a lot of people will say, like, nobody knew what I did, they just thought I came back from vacation or I looked rested.
I look rested. Yes, I've heard that.
So the Botox is a treatment. I always say it's like the hair color of my industry. If you don't want to see the grays, if you don't want to see the fine lines and wrinkles, that's every 3 to 4 months.
Okay.
The fillers are really important because as we age, we tend to lose fat in our face, and since we don't have, the skin cells aren't making as much collagen and holding things up, we tend to need to go ahead and restore some volume in the face to keep that youthful look.
Okay.
And those are variable. The ones in the cheek last up to 2 years. The ones on the lower face, about a year. The ones in the lips, we have a couple options. We have a 6-month option, a longer term option that is like 18 months.
I think that some of us have a prejudice against fillers just from watching those housewives. Because I think some of them have such exaggerated lips and immobile faces, and it's frightening to see that end of it. And I know that you don't do that. I don't mean to imply that, but I think people have that impression at times.
I will address that though, because early on in my aesthetics career, I went out to Scottsdale, Arizona, and I went to a training program, and they had this beautiful 50-year-old woman that she was there for the model, as the model. I mean, they put a little bit in her cheeks and a little bit in her lips, and I thought she looked great. And then the audience was like, "Well, what else would you do, doctors?" And then so she ended up. I thought she looked beautiful at like 2-3 syringes, And then they kept putting more and more, and then I had to go to the bathroom because I was having a little anxiety attack. And on the way home in the plane, I'm like, I don't think I picked the right field because that doesn't look good to me. But then it kind of dawned on me. I'm in Northeast Ohio. There's different looks in different parts of the country.
That is true.
So
that is true. We're more natural. Here, I absolutely agree with that.
So I really am focusing on restoring everybody looking back at your pupils. I don't want your cheeks to walk in or your lips to walk in the room before you do. So
that's a good thing.
Yeah, exactly.
We are running out of time, and I could ask you a million more things, but I mostly want to just thank you so much for being here. Folks, if you want information about NeoSkin, it is in the Hudson phone book, I'm sure by now. And if you have further questions or you want contact information, you know that you can email me at northof60hctv@gmail.com, and I will keep Dr. Bedrick's information with me so you can reach out to me and I'll make sure that you connect with her. Thank you so much for watching. Thank you so much for being here.
Thank you. My pleasure.